Hi, my name is Jamie, and I'll be doing my NG2 video. So I'm going to begin by just going in and greeting the patient. Knock, knock.
Michael Templeton, 12/25/1990.
Good afternoon. How are
Okay,
you?
perfect. So I have an order here
My name is
from the
Jamie. I'll be your
physician,
nurse this
and it's
afternoon.
to place an
Can
NG2
you,
low
before we begin,
intermittent
can you just tell me your name and date of
Before
birth?
I can do any of this, I need to get verbal consent.
Great. Thank you. And I'm going to
Is
check
this
your
okay if we do
ID
this
bracelet as
procedure
well.
for you?
John
Yes?
Templeton,
Okay, good.
1031 exit. Great.
So,
Good to
I
see
need
you.
to do an assessment before
So
I
John,
place the tube.
I have a doctor's order, and it looks like the
so
test
I'm
came
going
back,
to ask
and you
you
do
a
have a
few
small
questions.
bowel obstruction.
Have you
And
had
even,
any sort
it sounds
of
like
head
you've been vomiting and
injuries?
feeling kind of icky the
No?
last few
Okay,
days.
good. Have you had any
So what
sort
the
of
doctor's
nose
ordered
injuries or
is an
bleeding from
NG
the
tube,
nose?
and that means nasogastric
Okay,
tube,
good.
in order to suck out
I'm
some of
going
the
to go
extra
ahead and look
contents in your
inside your
stomach.
nostrils just
Once
to
we
make sure
do
that
that,
the
then they'll kind
skin
of
is
move on
healthy
to
and
see what's
intact.
next, okay?
I'm
So
going to go
I have
ahead
a
and
few
press down
questions
on one side and have you
before we get
breathe.
started. First of all, is it okay that we do this?
Okay,
Okay,
let me do the
great,
other
sounds
side.
good. If you have any questions, of course, stop me along the way.
Okay,
A
good.
couple of other questions I have for you, though.
Look inside your mouth.
Have you had any history of esophageal varices? Does that sound familiar?
Okay, good.
No?
So,
Okay.
the
Any
reason why we're placing the
fractures,
NG tube is because
facial
you have
trauma?
the bowel obstruction and
No,
because
nothing like
you
that?
have been having
Okay, very
nausea
good.
and vomiting.
Do
So
you
we need to go
have
ahead and
liver
release some of that
cirrhosis by any
pressure.
chance?
Nope.
Okay.
So I
Great.
need to finish
Sounds
my
like we're going to be
assessment, and I'm going
okay to get
listen
this
your bowel
going.
sounds.
I'm going to go ahead and grab all my things, and I'll be back, and we'll get going, okay? All right. So I'm leaving, and I'm going to put the record away. And as I come back, I've gotten my
Okay, and I don't
supplies,
hear anything, and
and
I'm
what we have
suspecting
laid out
because
in
of
front of
your
us here
obstruction.
are all the things that I'm
When
going
was
to
the last
need
time you had a
in
bowel
order to
movement?
help John with getting the
Okay, 3 to 4
nasogastric
days,
tube replacement.
and
So what you see here,
obstruction,
I
let's
have
possibly
some
pass
lube.
gas.
I have a 14 French large bore tube.
Do you feel any pain right now?
I have a towel that I'll use to protect
You do
his
feel a little
torso
bit of
area.
pressure and you are
I have a barrier that I can use to put the lubrication on.
start
I have a kidney basin. This is really just kind of extra in case I have things I want to throw in there. I have some tape. I have a paper clip.
grab my gloves.
I also have
So this tube is going to go
a container as well as a 60 syringe, 60 cc syringe tube that I'll be using for withdrawing stomach contents. I also have my makeshift hand sanitizer, hand cleaner, some pH strips, and these I'll be using to measure the stomach contents. I also have some water for him, and I have large gloves. So at this point, I'm going to re-enter the room and start the procedure. So,
14 French
knock, knock.
gastric tube.
hello, it's me again. I know I was just here, but can you tell me your name one more time?
John Templeton.
I'm going to go to the
Thank you so
earlobe,
much. Appreciate that.
and then to the sides
Well,
of the
John,
prostate.
we're going to get started.
So right there. I need to mark it with something.
I know that this can be a little bit. Oops. No, before I get going, I'm going to do a couple of things and just kind of check you over. So I'm going to start by listening to your bowel sounds. Can I listen? Can I
And
take a
then
listen?
that is going to help with the water.
So I'm doing some
I'm going
listening
to have
here.
you drink water during
Each
this
quadrant.
after I have you tilt your head forward, so not at first.
I'm going to do a minute
Fill
each
my tube
quadrant
up a
here.
little bit. Okay.
Okay. Not hearing anything.
On the tube
So,
that it slides down a
John,
little bit easier.
do you remember when your last bowel movement was by chance? Okay, it's been a bit. Okay. I have to ask you, have you had any flatulence, any passing gas?
Not at all.
Okay. How's your appetite been? I know, well, let me ask you first. Are you feeling nausea and vomiting or feeling like you're throwing down? No? Okay.
No.
How's your appetite been?
Not hungry.
Yeah, I kind of figured as much. All right. Well,
Spill
I'm
anything.
going to take a look at your nose, and this is just to
I'm
make
gonna
sure
have you
that we're
tilt
going to
your
be
head
placing the
back
tube
first.
correctly. And so this is going to be a little bit bright. So what's your eyes? Okay, I don't see a deviated septum. I don't see any sign of cleft palate. Have you had any fractures at all that you remember? I think I asked you before. No? Okay. So John, we're just going to check for what they call patency of your nose so we can pick the nostril correctly. So can I hold one of your nostrils and just have you blow out? All right, we'll do this one first. Blow out. Great, thank you. Blow out. Great, thank you. Okay, so it looks like the left side will probably be our selection, okay? All right.
You doing okay? sure it's in the stomach? Yeah, of course. All right. And if it's in the stomach, then I'm going to go ahead and tape it for you. So,
Use this just to protect your
I need
gown,
to
okay?
check to see if I'm
So we've got the
getting
tube.
fluid. Okay, good. I am. And it's green, so
The
that's
first thing we need to do is measure to make sure that we're going into the right spot.
I need to test
And
the
we do
pH
that.
of this, and it should be less than 5.
Starting here, pardon my hands in your face. So from the from the nose to the earlobe, down to the xiphoid process. Okay, so I already have some tape that I set aside, and this will be our temporary marker. So we're going to try not to put it too tight on there because we'll be removing this. All right. And next is going to be, I'm going to kind of coil this around my finger for just a minute to get the tube ready. Okay. That'll help a little bit. All right. Now it's time for some lube.
Alright, so I'm going to test the pH, pull it out like that. Right here.
All right, John.
Okay, good. And I do have a pH of less than 5.
This might feel a little bit strange, so
That means that we are in the stomach. So,
4 inches.
to
All right.
secure
You lean
this
forward and just
down.
take a couple of sips of water. And you can have another nurse come in and help you with that. So keep a couple of drinks. Great. All right. So continue to just keep coughing if you need to. Do you need another sip? Great. No, it feels strange.
Okay, no, it's a little bit uncomfortable at first, but you will get used to it.
You can sit back if you need to a little bit. Get it right. You
Now,
okay?
I need to set it up to a suction machine. I'm going to set it to low and put it in suction.
All right, Jim. So I'm just going to tape this temporarily because we're going to check to see if we have good placement. Okay. Try to keep the tape on your eyes.
And low is about 30 millimeters of mercury.
Right. You okay?
Yep.
And I see
So
it
I'm
is
pulling the
suctioning
gastric juices now.
the content in your stomach.
As I'm doing this, I'm noticing that they're green, and that's a good sign.
Are you doing okay still? Alright, good. So I am going to keep coming in here to check on you.
So I'll
make
get a
sure that
pH
you're
strip.
Okay. I'm going to
And-
the amount that's being suctioned from your stomach. And if there's anything you need or
I'll
you
check and
have
see
any
what the
questions,
actual pH is. I'm looking for it to be
call light.
less than 5.
So go ahead and call me if you need anything. And like I said, I will be in and out to check on you.
And
Okay.
still waiting for it to turn a little bit.
I'm gonna wash my hands.
And it looks like we're in good shape.
And that's everything.
So now,
Do it. Okay.
everything's good.
I was trying to tell you to lower the bed,
Oh.
but
We're going to go ahead and secure this a little bit more permanently. Okay, John.
I don't think it is, but also it gives super in Alaska. Like one of the days after. More, I kept getting to the end and then I did.
So here, use kind of a technique that allows this to be a pretty secure placement.
Before I start anything, can I have you confirm your name and date of birth for me? You can follow today. Okay, so it seems as though your
Makes it
doctor
challenging the next thing we need to do, I'm gonna ditch this tape for us. The next thing we need to do is set you up with some suction. Okay, so I'm going to turn on the machine, get it going, and we're going to be doing low intermittent suctioning. So we'll start by turning it on continuous, and then, oh, and it looks like we're in good shape here. So turn it on for just a moment. So now we'll put it on low intermittent, okay? The last thing we'll do is we'll get this kind of secured for you, okay? Okay. Okay, I omitted my other piece of tape, so we're gonna paper clip this, excuse me, we're gonna safety pin it to your gown, okay? That way it doesn't move around on you. How are you doing? Okay. All right. Well, yeah, at this point then, we're all done. I'll go ahead and make sure your bed is kind of in the position you want it, as low as possible so you're safe. I'll gather all the supplies.